바로 이어서 세션 1, 글로벌 보건의료 거버넌스 및 국제기구 입찰 추진 동향 시작하도록 하겠습니다. 글로벌 공공조달연구센터를 운영하시는 카이스트 경영대학 김만기 교수님께서 Direction of Global Public Procurement in the Future 이라는 주제로 발표 시작하겠습니다. 앞으로 나오실 때 큰 박수 부탁드리겠습니다.
여러분 안녕하십니까? Good morning, everyone. The Korea actually autumn is the best season in a year, and blue sky, and we call it horse and feather. And enjoy your time in Korea. Public safety is already an important issue, as you all heard about a tragic event, and our prayer hope goes out for the victim and family and who lost a loved one. Today I'm going to talk about global public procurement trend, what happened before and post-corona. What is it we can do as a Korean health sector industry in collaboration with international stakeholders, like many of you come from different countries. Procurement trend, obviously, we thought all of the pandemic is finished by this time, but we still have some social distance program going on, and we still, our policy at the moment, we don't need to wear the mask outside, but we have habit of wearing a mask, we still have it. We hope to see that this thing will go away, but at the moment, we still fight with the pandemic. Due to global uncertainty, we have it, and it is imperative to find the role of actually public procurement as a sustainable mean to support the financial resources and infrastructure for health system. Obviously, COVID-19 occurred end of 2019, put us into the very, very serious situation since Hispanic actually and the flu. Even though we had a reasonably well-balanced health system infrastructure, a lot of OECD countries, developed countries, had a lot of victims. We're still suffering. COVID-19 pandemic is still going on in many different countries, and now because of the emergency and the spread of new supply chain interruption and disruption, inflation of the goods, and also subsequent monetary constriction policy, and make it very hard for any country, especially emerging country, underdeveloped country, we have hard time. So it's a little bit of irony because we have COVID-19 and everybody's suffering, and one life is precious, but we have more than $6.5 million confirmed death because of COVID-19. As a procurement expert, on one hand, we have COVID-19, the people are suffering, but in terms of global public procurement, Korea has been a focal point of supplying many PPE and other medical devices and equipment in the past. And also make things worse, as everybody know, and since Russia invaded Ukraine early this year, that put us in a very awkward position that we have a serious problem with the global supply chain, especially with the medical supply and infrastructure. We have today unique opportunity. Have Dr. Dorin from World Health Organization, Ukraine Emergency Officer, came all the way from Ukraine. And also I had good opportunity to talk with the Deputy Minister of Ukraine, talked about their emergency need, and what is it we can do as we as the Korean, the healthcare industry and international community. So we will have a video message with him together today. World Bank estimated more than $100 billion needed to restore infrastructure in Ukraine. So we have four actually key objectives behind a supply chain challenge that we have in this day. When we have issue with a pandemic like this, when we have a consolidated purchasing power, that means we have more purchasing power instead of individual entity trying to buy one product group. If you consolidate the many, like that's exactly what UN doing it, UNICEF or UNDP going out purchasing, World Bank does the same way. So if you drive the sustained commercial value you can achieve when you actually collectively work together. If you can do that, then you can mitigate the supply chain risk because you cannot rely on the single source. You got to have multiple different sources of supply. By doing so, you can satisfy the user preference, because China been known as a warehouse of the global health system. In PPE and the mask and sanitizer, everything used to come from China. I can remember I conducted actually emergency UNDP market research for Korean PPP early part of 2020, because all of the goods out of the China, we had a serious supply chain management, the poor quality and the logistic issue and many other, and some financial disruption as well. So Korea became alternative source of becoming world the warehouse basically for the PP. I can remember when we actually sell out mask and sanitizer test kit, many Korean company had unlimited opportunity, even though we had at the other side of the world, we have a tragic event of people losing their life, but Korean industry enjoyed very good business. Actually, that is true, especially with the diagnostic kit and rapid test kit. Korea became an emerging country to provide alternative source of medical supply and the devices. Especially for the PP, what we learned, because as you can see, all the mask and the small item and the shipping costs, logistic costs sometimes more expensive than product itself. If you put a 20-foot container with a mask, very light an item and merchant, and logistic costs will be much higher than product itself. I personally had experience with shipping the couple of container with the Korean industry, shipping hand sanitizer from Korea to New York, to Miami. Actually, it cost twice of the logistic cost than the product itself. So localization, I think, is a very important issue. So especially underdeveloped country, when you have an issue with the PPE production, it would be better to have local production. You can be prepared in the future. So we learned a lot of lessons why we had such event, and we could have done better. That we always said that whenever we have some issue like this emerging threat we have it in pandemic, we already think about we could have done better job. I think corona pandemic also gave us a lot of things we need to think through. One of the things was the flexibility of our system. We thought we have infrastructure to support, but actually when you open the Pandora box, everything was not prepared. And mobility was a big issue and logistic issue. So we need to have actually redefine our healthcare procurement. What is it we have to do, make it better in the future when we have such instance? So we got to have a consolidated and comprehensive catalog. I'm going to introduce later on the ODA directory we developed with the Kitty and the assist the recipient country, especially for the emerging country. And also we have to have a creative engagement with the supplier, make sure they follow sustainable model, not just selling off the price, but sustain their quality model. And supply diversification is very important, and the partnership for the success, partnership with the stakeholder. Obviously, any country improve your health system, you need a politician and their political willingness to make it better and transparent, fairness and procedure, and procurement all about actually transparency. So the industry is very important, but industry cannot go along without having political willingness from a stakeholder, a politician is very important. So we have basically people from Africa and ADB and WHO. That's what international organization pursuing to have a better system, transparent, so we can actually see what's happening, all the money putting in, where it's going, how we can best utilize it. So this is a ODA directory. If you can, you see the little QR code on top right end. If you can take a picture of your camera, you can download. Oh, Korea, we have very good technology. Hey, please do so. We don't have any hard copy. If you can click right on the top, okay? Take a picture and you download it. Entire directory will be available for your review. So I'll be able to introduce this directory. The reason we came up with the directory is because Korea K-quarantine, we call it, and the testing, tracing, and treatment. We spend a lot of money to promote how good we are, how well we are doing in Korea as a K-quarantine. Okay? We call it 3T policy. The problem we have to admit, when our recipient country, for example, underdeveloped country, emerging country, come to us knocking our door, okay, by the way, what have you done with the testing? What solution do you have a tracing? What about treatment? And we did not have detailed, specified catalog. We can't give it to them. That was a major problem. So we did a lot of promotion telling them this is what we are doing. We are very good, but when they coming in, when customer come, we did not have any menu with the pricing and the clear descriptions. That's why Kitty, especially with the leadership of Mr. Bae, I was working with the Kitty almost 1.5 years. And also thanks to Dr. Patrick Osby from ADB, we've been working together, come up with a concept. So this is directly for any sort of recipient country, for emerging or underdeveloped country, have a look at what we've done for Korea and the K-quarantine. You can take a sample of what Korea did it. You can basically develop your own solution. We have 2 pillars, healthcare policy and system, as you can see, and then healthcare resource and service as implementation tool. So each pillar has a testing, tracing, treatment element. You can pick and choose. As you can see, the policy, the design mechanism, you have diagnostic testing policy and governance issue. And for tracing, you have different element, and treatment, you have a lot of different menu for consultation. So this is what exactly we have to do to make it easier for you to read it through and put package together to learn about what we've done, and then you can go from there. And then second pillar of the healthcare resource and service as implementation tool, you can see actual product, like a walkthrough, a screening station or mobile station for infectious diseases, not only for the COVID-19, any other communicable diseases, okay? And then tracing is the same thing. Korea is known for very advanced ICT. Korea is one of the most well-connected countries in the world. So we use our base technology to make it all this happen. So I'd like to introduce a few examples how this directory works. Number one, actually, item is diagnostic testing policies and governance. So managing agency, this is illustration only. We're not saying that this is the agency going to do and managing all this project, but this is the example of the Korean Exim Bank and Korean the Development Institute on the KOTRA, Korea Trade Promotion Agency. This can be a managing agency, but we can have many different implementing agencies. This item you see it over here, diagnostic testing policies and governance, is not something that we come out of nowhere. This is something we've done individually. All different walks of life, they did it already, but we did not have any collective effort to put one catalog. That's why we did it. So when you look at it, we have a solution in medical school, in university, and hospital in Korea can provide this sort of a consultation advisory role. The policy consulting can be done by KSP, the knowledge sharing program, is a grant program provided by Korean government. Okay? So this can be a good example. In duration, even because we've done this work before, we have clear idea how long this will take. Depend on the recipient country, your capability, it can take anywhere between 6 to 12 months. Okay? Let's look at another example. So number 6 is a communicable disease and surveillance system based on ICT. Very interesting. How we track it down using IT infrastructure. Of course, all this tracing program heavily depend upon your IT infrastructure. Okay? Some of the country and you come from, you may not have the same level of capability, but you can adapt what we have it and learn from what we've done before. We obviously cannot make everything perfect, yeah, but you can use it from that one. Also, we have a different agency can do it. As you can see, schematic diagram of automatic sort of warning system. These are the ones we implemented by Korean CDC. We don't have any mandate anymore. Korean CDC do not impose any PCR test anymore, but we used to have that one. But they will trace you Any moment, if you have a positive case and a foreigner come to Korea, you have to report 72 hours, and everyone will have a message appear in English in your mobile phone. If you're trying to walk out of a hotel, someone will knock on the door. Excuse me, where are you going? How good we are well connected in Korea. So it is a real experience where we did it. That's a capability we build upon. And number 13, it actually is a consultation of vaccine logistics and vaccine management. This is a huge issue. I'm sure the ADB and Dr. Owese he's expert of expanding program, developing ADB program. So this is not one-off program. The COVID-19 is one thing, but we'll have more COVID, more communicable disease in the future. We don't know. We have now a pandemic, they call it, with the flu plus pandemic. We can have the monkeypox, any other disease in the future. You need to have a vaccine logistic and vaccine management issue. So this is a template, what you can do. You can see this, if you have this sort of a logistic and vaccination management system, it will take 6 to 12 months. So how you put these two together? Now, we see a number of different options. Now this is menu selection, okay? So this is a real good exercise. I'm doing actually with one particular country. I can't name them, but I'm working with a health secretary of the recipient country of ADB, working exactly the same way what I just described to you. So we had a menu from testing, tracing, treatment, and he pick and choose which menu is relevant to their country. Have a look at the first one. So he select 3 different menus over here. Conducting policy advisory role, which will take 6 to 12 months. Our estimate cost about $250,000. And creating whole chain system for vaccine logistics. It will take about 12 months, just under $2 million. And then supplying and installing mobile negative pressure at the ward. Okay? Anywhere between 6 to 12 months, depend on your situation, your country, $2.8 million. So the reason we put estimated budget over here, because we know we've done it in Korea, we know we can make this work. So the first case study demonstrates, okay, country A, a U.S. recipient country, come to Korea. Okay, this is what we want. Let's look at the country B. They have a little bit more actually aggressive plan. They have a creating mobile diagnostic testing center. This is treatment they want to have it, okay? And then they want to have actually testing center, they will establish it, and vaccination deployment plan. So all collectively together is $8.2 million, okay? So this is what we learned from our system last 2.5 years with enormous cost. Korean government put unlimited, I think, amount of the resources within the budget. That's why we did it. So all of the solutions we're presenting today is something we can do. It's doable. It depends on your actually and the needs in your country. So once we have this sort of element, this is how the project will flow through. It's procurement is all about using public fund. My presentation does not include the commercial procurement. This is all about public fund. So public procurement is basically 3 main elements. Where the money comes from? Public fund, the taxes. All your money is public procurement. Number 2, because of the public fund, you have to follow rules and regulation of the procurement. Number 3, all the benefit of using public fund, following and comply with the public law is called benefit goes to the beneficiary for the public interest. That's all about the public procurement. So if you want to use any of our directory concept, what we've done in K-quarantine, the testing, tracing, treatment of what we've done in Korea, we have a number of different elements of it. As you can see over here, Kitty, we issue the ODA directory, you review, have a look at it, you can actually put together your own idea. So when you come back, sending back to us a program design request, we'll be able to work with you, come up with idea. Because you're like a chef in a restaurant. You choose your recipe, I'll go in the back, I will cook something for you. Kibimbap and kimchi and bulgogi, okay, for you. Exactly the same way we work. So after that, when we're satisfied with your requirement, you're happy with what we presented to you, and then we will do our best to secure your funding, whether we do it as a grant or the loan. Obviously, loan will take a long time to secure, but we have a number of different grants available from Korean government. as OECD member country, Korea has more than $3.8 billion and an ODA program and loan and grant. So when you have smaller project, as you can see, a consultation program normally provided by the loan, the grant, but a longer program and anything more than 30 million, 100 million will be done by the Korean EDCF, Economic Development Loan. Sometimes work with international agency. This is a summary of how I like to see we as international community for healthcare specialists, healthcare authority prepare for the future using Korean K-quarantine experience, what we've done, okay? And using ODA directory. 1.5 years of endless and consultation and with the industry and the government authority and some recipient country. So ODA right in the corner and the ODA directory is there and we can expand our scope. So we can see, as you can see over here, healthcare policy and system and the KAIST and knowledge sharing program is grant, and then we have a loan program. Actually, Korea provides a lot of different types of grant. Even with ADB, we have a trust fund provided by the Korea eAsia Fund. And the World Bank, we have an EBRD, Interdevelopment Bank. We got a lot of different programs available. Okay? So you as a recipient country in Africa and other country, you actually have opportunity to come to us. So use our directly and to develop something flexible, provide you mobility, so you get better prepared. So in your policy implementation, you will have a better system in your country. When we have another pandemic in the future, communicable diseases, everyone will be well prepared. So side note, I mean, a lot of now the debriefing going on with the Halloween party with the young people and could have done better way, right? Everybody agree. 100,000 people get together and why didn't police have a preventive measure? Okay? Make sure we have all of the bar entry and control. Why did not have that one? Exactly the same thing work, I think. Pandemic hit, we were not sure what we can do. So now we learned the lesson in 2.5 years, but if we do not prepare next wave of pandemic, using lesson we learned, implementing different policy, work together international community, using not only Korea, there are a lot of other countries have a good example of the success case. Use that one. So my last comment is click right on the top of the CR code and then the download information and send your inquiry. If you have any question, inquiry, please get back to us. We'll be able to help you out. You can send an email to me, and Kitty and I will be here to assist you. I hope you enjoy your time in Korea. Korea as a country, back in 1962, the time that in my generation born, Korea GDP was $82. North Korea is $400. So we are one of the poorest countries in the world. Last year, Korea GNP per capita was $33,000. So we are the 10th largest economy in the world. Under the capitalism, Korea is a single, unique country, grown 350 times over the period of time from 1950 Korean War. So we learned the lesson. We know how to build Han River miracle. Even with the pandemic, Korea, we as a country and the people, we did a lot of work together. So we are here to help you, work with you. And then if you can come back to us and work collectively, I think we can have a better and healthier and a longer life for happy family, global citizen. Thank you very much.
네, 큰 박수 부탁드리겠습니다. 네, 김만기 교수님의 발표였습니다. 다음은 ADB 아시아개발은행 닥터 패트릭 오셰위 국장님께서 ADB Public Healthcare Project and Procurement이라는 주제로 발표 시작하시겠습니다. 네, 국장님을 앞으로 모시도록 하겠습니다. 네, 여러분 뜨거운 박수 부탁드리겠습니다.
Thank you very much to the Minister of Health through KIDI for inviting, and KAIST for inviting ADB to this meeting. And thank you very much, Professor Kim, for an excellent presentation. If I was the president of Korea, I would have chosen you the ambassador somewhere. Excellent presentation. So what I'm going to talk about is about the Asian Development Bank, which is the second largest development bank in the world. We support, we are a member of membership of 68 countries, and 52 of those countries are 42 of those countries are developing countries. And so what I'm going to go through here is only what we do in the health sector. We work across all sectors in government. We support all sectors. We also support the private sector. But my presentation today will only focus on what we do in the health sector. Okay. So Professor Kim talked about COVID, and for us at ADB, we did a very extensive consultation. We talked to many of our member countries. We talked to many sectors. We talked to the health sector. We talked to the urban sector. We talked to energy sector, transport sector, to understand the education sector, the social protection sector. We also talked to other development partners. We talked to think tanks. We talked to private sector companies. We talked to universities to understand what COVID means to them and what COVID means to their countries. And we have consolidated all that in what we call health sector strategic directions. So what ADB is going to do over the next 8 years, between now and 2030. So I'm just going to highlight a few challenges that arose as a result of that. So the pandemic is still ongoing. It's waning, of course. And as we look at the region, we see that there's a significant demand and utilization of health system. For the first time in the history of the world, we no longer need to make a business case for health. For many, many years, many countries did not invest sufficient resources for health. And the assumption there was that if this is very rapid economic growth, the government is raising a lot of money from taxes, and that the resources will be channeled to all sectors, and therefore the health sector would benefit. That trickle-down effect actually did not work quite well in the region. And therefore, as we look at COVID, we see that there are some lingering impacts that the pandemic has in society. One, demand and utilization of health services is up. The health system supply issues are a major challenge. As Professor Kim was talking about, we saw major challenges in terms of supply chain. Many places, and in some of our countries, for example, Philippines is 7,000 islands, and Indonesia is 18,000 islands. You can imagine the supply chain that is required to be able to have health products across those large countries and many islands. Scaling up lessons learned and applying innovation is a major issue that we identified. And Korea was an example whereby Korea was the first country to identify a COVID test even before COVID was reported in Korea. Just by looking at the genome that was published by the Chinese online and taking that genome to try to come up with a test kit was a great innovation. And Korea is really innovative in many ways, as you'll learn. And also a lot of those innovations are in the source book, the directory book that Professor Kim was talking about. And then looking at the long-term impact of pandemic, what does that really mean for the region? What does it mean for the health sector? You have significant underfunding. If you were to leave it to the health people, they want all the budget to go to the health sector, but that's not true, because in a country, many countries, there are 32 sectors, 28 to 32 sectors. Each of those sectors need a budget, and therefore there has to be rationalization of resources, and to be able to do that and catch up, and for the health system to be like Korea requires a lot of resources. In addition, you also need to allow the private sector to be private sector and lead the innovation and lead the service delivery. Looking at issues around health insurance, Many countries are still struggling with issues of health insurance. Not the entire population is covered, and those who are covered, it's not sufficient coverage to take care of people. I recall just before the pandemic, there was a workshop like this in Japan, and one participant got sick and was admitted for 2 days. And when he came out, we were all worried that the bill was going to be very big, because if that had happened in the US, the bill would be over $30,000. And I asked him, how much did you pay? They said $25, because they have universal health coverage. The same would apply if you were to go to a Korean hospital for emergency purposes. You'll get almost free care. So this is how countries have been able to achieve universal health coverage, and looking at how do you ensure that people do not become poor because of healthcare. And also, the other thing that also was highlighted by the pandemic, and this is something that we are having discussions, Seoul National University and many other institutions around the region, is what kind of the healthcare workforce do you need going forward? For example, if you look at 2030, what kind of health workforce would we need? We realized during the pandemic that we just didn't have sufficient mental health experts. There was significant mental health that affected both the young, the middle-aged, and the elderly, but there was just no mental health experts, not just psychiatrists, but mental health experts across the board. They want enough epidemiologists to lead the pandemic challenge. They want many radiology technicians. There was so many skills that were lacking in the health sector, and that we as an organization now, we are bringing experts to begin the dialogue regarding how should the health sector look like in 2030. And in one country like Bangladesh, we're actually providing significant resources to the Ministry of Higher Education to address this issue. In this country and many other countries in East Asia, there's significant elderly population, and I'll talk about that in my presentation. Now, if you look at how is the region doing on universal health coverage, we find two things. If you look at the global UHC service coverage index across the globe, the average is to have about 65% coverage. Many countries in our region are still struggling with that. The low-income countries, which are in black, the dark blue are the lower middle-income countries, and also the light blue are upper middle-income countries. So across all the countries, be they low-income, middle-income, or upper middle-income, they're still struggling with the issue of UHC. But if you look at how the household health expenditure, the amount of money that you spend if you go to seek healthcare, is still a major challenge, because a lot of people are still spending significant their own resources to pay for care. And that is a serious challenge, because it means that people are actually selling their assets, they're selling their land, they're selling their cars, they're selling their houses. If you have someone who is really sick with cancer or any other condition that requires extensive healthcare, the society should not be like that. A society should be that when you're sick, the system should take care of you. That you do not work until you grow older, and then you get sick and you sell all your assets and you're plunged back into poverty. So if you look at, so what are the underlying challenges and influence that we face here in our region? There are 4 issues that I would like to raise with you today. The first is we have very rapid urbanization. Just before the pandemic, almost on a daily basis, 120,000 people were going to the cities every day across the region. 120,000 people. You can imagine what that means to the urban centers. So what that leads to is you have challenges with noise, water pollution, you have a significant number of road traffic injuries, and therefore you cannot cope. The primary health system cannot cope with this massive influx into the cities. The second challenge that we're also facing is that if you look at our region, and our region is divided into, our world as AIIB is divided into 5 regions. So we have South Asia, that's where you have countries like India, Bangladesh, Nepal, Maldives, and others. We have Central West, those are countries that ends with mostly Stan, Afghanistan, Pakistan, Uzbekistan, and others. We have East Asia, And that's where we have China and Mongolia. We have Central, Southeast Asia. That's where we have Philippines, Indonesia, Mekong countries like Thailand, Vietnam, and others. And then we also have the Pacific Island nation. If you look across that world, we see that in South Asia, we have a combination of the population is growing older, but you also have a rapid population growth, and you still have a lot of infectious diseases. If you look at Southeast Asia and East Asia, the population is growing older much more rapidly, and that becomes a bigger challenge because as the population grows older, there are more chronic illnesses, and therefore you get more non-communicable diseases, which is a big challenge because if you have, for example, bacterial infection or malaria or any of the infectious conditions, you go and see a doctor, you're given antibiotics, and after 5 days or 14 days, you're cured. If you have a chronic illness, you have hypertension, or you have diabetes, or you have cancer, your relationship with the health sector is for many years because it's not a one-time thing. It's a progressive engagement and involvement of the health system to help you, and it's very expensive. So what that means that it's causing significant resources drain from the national fiscus. The third one is decentralization. Many countries in our region are also large, and that means the smaller ones are decentralized. And as you decentralize, to ensure that health services reach the lowest common denominator or reach where people live, the challenge now you face is the issue of governance, the issue of communication across sectors, across borders, be they state borders or county borders or district borders, major challenges. And then how do you share information in a situation like that? And then if you look at a sub-region, like say the Mekong sub-region or the ASEAN sub-region, how do you track infection? And we saw this during the pandemic. Countries were implementing lockdown without talking to each other. Simply say, we don't want anybody coming from into this country from anywhere. Sometimes perhaps the systems are so close to each other and the border is so porous that even if you put a lockdown, say between one country and another country, it might not actually work. So there wasn't much thinking in certain situations. And then of course, digital health is a big issue that I'm sure the private sector here, then this is something that the private sector will lead, is how do you do digital health to overcome the shortages of healthcare workforce? I mean, we've been talking about this since I graduated from medical school, that there aren't enough doctors, there are not enough nurses. And we're still talking about it today, and I'm sure we'll talk about it 20 years from now, because we'll never have a situation whereby you're saying you have enough healthcare, all cadre of healthcare. So you have to think about what's the best way to overcome those barriers so that we can respond to the emerging challenges as they arise. And then, of course, how do you ensure that you maintain the quality of healthcare? Because not just a matter of numbers, volume, you need that the services that are being provided at every healthcare facility is a good service. And as we promote primary healthcare, we need 4 things at the primary care level. The first one is the facility has to meet minimum standards. We did some work in South Africa many years ago, whereby we did an audit of the 4,000 public facilities in the country. And at the end, we concluded that one third of the facilities needed to be demolished. The second third needed to be upgraded, and the 1/3 was okay. And so you need good facilities. Second, you need human resources to be able to work in those facilities. There's no need to have facilities and no staff. Third, you need equipment for those facilities to be able to work. You can make a diagnosis, the equipment that you need. And lastly is the ICT system to be able to transfer information across various facilities. And I just want to mention in 1 minute this issue of aging that I talked about, because it's a big problem in our region, but it's also becoming a global problem because the population is great. With good healthcare, people live longer, the population becomes older, but also with good family planning, there's also decrease in the number of children being born. So you have a scenario whereby you have more elderly than the young population. So how do you ensure that people live longer with good health? That's going to put a lot of pressure in our region and also across the world. So if you look, and we've done projections looking at between green one is going forward, no? Yeah, there. Yeah, if you look at our region, and if you look at, you'll see that over time, and here we are focusing on people above the age of 60, and you look at between 2000, 2020, and 2050, you find that the elderly population is increasing at a very, very dramatic fashion. And so the question is, are we ready to deal with these huge numbers of the elderly in a population? In some countries, they've already reached what we call super aged, meaning over 20% of the population are above the age of 60. This is the situation in Japan, for example. And so you face major challenges with what do you do? How do you ensure that people live longer with very good health care? How do you ensure that people live longer and actively participate in the economy for many years to come? But then the biggest issue, of course, is NCDs. Non-communicable diseases increases dramatically. The numbers of chronic illnesses you have when you're in your 20s and when you're in your 50s or 70 are very different. And therefore, how do you deal with expensive healthcare? Because as people grow older, they have cancers, and cancer takes money to treat. The analysis that we've done in China shows that it's going to be very complicated for them to deal with that in the next 20 years. In Japan, so China is the second largest economy, Japan the third largest economy. They're really struggling with it now, but then also start to struggle with it even more in the year 2040. So now they're starting to do programs and looking at how to reorganize the health system in terms of importing workers, in terms of using technology to be able to take care of the health challenges that they're facing. If you look across the region that I talked about, you'll see that stroke is a problem across the entire region. And diabetes is also a problem across the entire region. So the challenge we are facing in our region is that in some countries, up to 40% of the people have hypertension and they don't know about it. Second, up to 20% of the people have diabetes and they don't know about it. And this is across the world. So if you're to have a healthy population, you really need to screen, because screening for hypertension is the simplest thing to do. Screening for diabetes is a bit complicated, but yesterday we met with some Korean businesses here that are trying to come up with various ways of using technology for screening. And it's very interesting what you see happening in the market. How do you screen millions and millions of people for diabetes and for hypertension so that they can seek care before it's too late? Because if you wait until it's too late, people come with challenges. They already come with a stroke, and therefore that requires ICU. Very expensive to manage. So I think that every health system today should think about how do you screen for the basic chronic illnesses, and that of course depends on the region. It could be diabetes and hypertension I've talked about, but it could also be cervical cancer, it could be breast cancer, anything that is a problem in your region. Please ensure that you use technology to start screening. And then as we look forward, we see four things. One, there's still increased spending in health because of the business case that the pandemic has done, but we also have to prepare ourselves. This is what Professor Kim was talking about. We see that in our region here, in the last 30 years, we've had 4 pandemics starting from here. This is a big issue, and therefore we are discussing at length how do we prepare the health system so that not every outbreak that starts become an epidemic at the national level or a pandemic that is global. So we need systems in place to be able to be better prepared. There are many initiatives that are going on right now by the G20 group of countries, by the G7 group of countries to be, and also with the national government to address this issue. The second one is that health problems cannot be solved just by the health sector. If you look at road traffic accident, for example, this is not, the health sector is a recipient of a consequence of poor system. And therefore you can't solve it as a health person, as a health sector. You need the transport sector that's responsible for policy and other aspects to deal with it. We need the urban sector to deal with this. So this requires various sectors to work together. The challenge is that leadership, there's no minister for many ministries. There's only one minister for health, one minister for transport, and sometimes they don't talk to each other for a variety of reasons. So how do people work across sectors if budgets and leadership are not linked together? I've talked about technology, the use of digital technology, and also more demand for knowledge. How have other countries done it? We are currently in a country that does not have any minerals. Korea does not have any minerals. The country has grown because of knowledge. How do you share this knowledge that has led to many technological advancement? How do you share this knowledge? How has Korea done it? How have they done the healthcare? How do you collect, if you go to the health insurance here, they have a very excellent system of collecting resources from the population, be it formal or informal sector. Many countries are dealing with how do you collect premium from the informal sector? And how do you also ensure that there's transparency in terms of healthcare? How do you use technology to determine the essential benefit package? Because of you are able to see what are people coming, what is the healthcare seeking behavior? And therefore you put in your package based on the demand that you see in the country. So I'll just simply quickly summarize that we are a new, in the health sector. I mean, we've been a bank that has been there since mid-60s. We focus a lot on infrastructure. We've built most of the roads and airports in Asia were built, funded by AIIB. The first loan was actually to Hong Kong in 1966. So we built massive infrastructure in the region. Health is new, it's about 10 years old. And the average that we are lending was about $3 billion. But during the pandemic, it became 12 billion. And then in 2021, it was 30 billion. So actually a third of our entire portfolio. And we see the trend increase. We see the trend of more resources for health going forward. In the projection in 2022 is 17 billion, 2023, 20 billion. And 2024 is still far because usually the engagement is 2 to 3 years out. So we're still getting more requests for 2024. So these are the areas of interest: governance, issues around regulation, legislation, and how to manage the health sector, basically the governance of the health sector, workforce that I talked about, both managerial, clinical, and technical, the infrastructure, looking at the entire value chain, looking at issues around financing and incentives, and also looking at issues around pandemic preparedness. This is the feedback we got from all the consultations that I talked about. Climate change and health is a big one. And currently the G20 are 20 countries that constitute 80% of the global economy. Indonesia is the presidency of the G20. And one initiative has come out of that presidency, the establishment of a pandemic fund, starting with $1.4 billion to provide resources to developing member countries to be able to prepare for the next big pandemic. The next G20 presidency will be India, and starting from 1st of December. And there, and we are very much involved in those discussions, is looking at issues of climate change and health. Because we saw, like in Pakistan, the floods in Pakistan have had a very severe impact on the health of the people in terms of access, in terms of infectious diseases, and so on. And so next year, in the G20, the biggest discussion will be on climate change and health. So this is just a few examples, just very few examples of what we have. Like, for example, in Pakistan is a loan of $50 million to look at addressing the weak secondary hospital system. The primary care is much stronger than the hospital system, so the government wants to support from us basically to support the hospital system. The focus there is green infrastructure. What kind of hospital do you need that with the floods cannot be washed off? Looking at issues about ICT in the health sector and so on. Second is India, and my colleague Dinesh is the one leading the work in India and Bangladesh. Very innovative opportunities there that you can discuss with him during break. But basically is strengthening the healthcare, looking at issues around manufacturing, looking at issues around the establishment of the national centers for disease control across the various domains, and looking at the issues around ICT. So ICT is very big for us, and also training our healthcare workers, looking at the emerging areas is top priority. Now, just in closing, we have very close collaboration with Korea, looking at issues around vaccine manufacturing, both on the training side and also on the human resources, looking at options to collaborate in terms of facilities, and also looking at ways of collaboration in terms of regulation, both for vaccines and therapeutics, looking at issues around medical education, that's top priority for us, like I've said, and also issues around digital development. So currently about $5.3 billion in terms of contracts across many countries in 2018 to 2022. Thank you very much.
네, 고맙습니다. 오셰위 국장님의 발표였습니다. 그럼 계속해서 세 번째 발표 이어가도록 하겠습니다. 다음은 WHO 세계보건기구 닥터 도린 로타루 국장님께서 WHO Emergency Support and Procurement for Ukraine이라는 주제로 발표 시작하시겠습니다. 큰 박수 부탁드리겠습니다.
What I'm missing in comparison to my previous two speakers is a tie. So if someone has one to, yeah. Anyway, so my idea was to keep my presentation a bit less formal. Why? First of all, because I will speak about a tragedy which happens now in Ukraine, and that's why I wanted to be a bit less formal so that we do not fall into a certain status which will somehow influence our the work of our event. So anyway, my name is Dorin, and I am currently working for WHO Ukraine as operations support and logistics team lead, managing the entire operations of WHO in Ukraine. As you can see, I wanted to start my presentation with one of our first successes which we had into the country, is basically bringing 20 brand new 4-on-4 ambulances using one of the largest airplanes which exist now in the world, which is the Antonov cargo airplane. The biggest was destroyed during the first days of attack, which was parked in an airport in Kiev, and this one is the second largest. So, besides ambulances, overall, what does WHO do in Ukraine during its emergency response? I'm not sure what button I have to push. Okay, this one. Okay, great. Okay, so overall, as you can see, this is the list of items which WHO is supplying into Ukraine. The biggest share, and as mentioned by my previous speaker, is the impact of NCDs, especially on population, which is getting older. That's why one of the biggest share for WHO is insulin. The second one is WHO kits, which we will come back to the kitting later. Then on the third place is biomed, and on the fourth place is ambulances. Why ambulances on the fourth place? Because every day we have about 33 ambulances destroyed during military activity. So that's why the losses of ambulances is continuous. So that's why the overall estimation of ambulances, the requirement of ambulance exceeds 600 units at this point. So I wanted to share this map. Actually, this is the distribution of our supplies across the entire country in Ukraine. So as you will be able to see, though part of the country is occupied by Russian troops, still you will observe that most of the dark blue regions are located close to the contact line, and there where is the most of supplies are going to. So you will, unfortunately, I don't have a pointer, or do I? Oh yes, I do. You see, this is the contact line. This is also Odessa, which is very close to the contact line and close to the Black Sea. So that's why the majority of supplies come there, plus Kiev, because Kiev was attacked during the first period of war. And then we have Lviv, which is our backup base, WHO, because it allows quick movement to Poland. So as in terms of, well, why WHO is so efficient comparing to other UN agencies working in Ukraine? First of all, because we have 5 warehouses, and they are located in 5 regions. 4 of them, as previously mentioned, are located close to the contact line. And this is Odessa Oblast, which is, yeah, very close to Black Sea and the occupied territory of Crimea. And as I mentioned, the 4th base and warehouse is Lviv, which is basically the main hub of entrance of all cargo from European Union, and not only, because basically the only airport which can be used now for accessing large cargo is through Poland. Well, because I have promised that I will get back to the issue of kids in order to address the, let's say, emergent needs of population on the ground, WHO has has developed, especially for emergency settings, several types of kits, but basically contain at this point all the required medicines and medical supplies for a particular type of intervention. So, and those currently are being, those that are currently being supplied to Ukraine are blood transfusion kits. The second is interagency health kits, which are basically formed from medicines, and it has been formed between a close cooperation throughout several UN agencies that have conducted needs assessment on the ground. Then we have NCD kits, we have pediatric kits, we have trauma kits and trauma backpack kits, if I'm not mistaken. And then we have a 7th one, which I didn't manage to include, is the cholera kits. And because cholera now is being a major problem expected for next year, especially when we have issues with hygiene and water supply due to infrastructure damage across the country. Okay, so throughout, well, starting from March 2022 till now, WHO assesses the catchment of population that has been provided with continuous health care using our products that we supplied, and especially those health kits, equal to 8 million people. And as you can see, even though the amount is the number of population for trauma kits, it's only 33,000 people is the catchment, though the amount from 8 million, which was spent throughout for all the entire kits supplied in Ukraine, is the biggest. Because currently now, trauma is the main cause of illness, which is now assessed in Ukraine according to the Ministry of Health, and then the NCDs come the second. Okay, so following, of course, civilian victims, of course, we have victims across infrastructure. And what I wanted to highlight is the damages which are suffered by the healthcare sector. And for now, until today, as of 10th of October, we have about 500 medical infrastructure units that belong to 218 medical facilities have suffered or have been completely destroyed. And those 218 health facilities before the war used to provide health services to 400,000 people monthly. So imagine the impact of the tragedy. So what I wanted to show you, this is how a blood bank works now. I mean, basically in basements. This is patients have been basically moved to hospital basements because the upper floors are destroyed. So, but getting back to our procurement. So, WHO emergency procurement, everybody is very curious how it looks like and what is it about. Basically, this is it. But it's very complicated. I mean, it looks complicated, but let me summarize. I would like to say that actually it doesn't seem too different compared to what public procurement looks like and what other UN agencies do. So here, everything starts with a needs assessment. We pass through quantification, specification development, bid announcement, bid evaluation, tender award, contract signing, logistics, delivery, and then training of the end user. So this is nothing different, except several things. In terms of emergency, WHO has some flexibilities compared to other UN agencies that allows us to do certain direct procurements for which are usually for higher amounts compared to the regular situations, or flexibilities in terms of conducting faster procurement processes using at least only 3 bids without passing the entire, let's say, regular procurement process. And a third flexibility is in case of situations when the national authorities cannot, the local capacities of WHO are not sufficiently developed to conduct emergency procurement, sometimes WHO can allocate resources for partners from the governmental sector to do procurement for them. However, one important thing actually is what we have to consider, that WHO has its own quality assurance process, and this is basically a very big limitation which we have to consider, because WHO across the entire globe has specific requirements in terms of the quality of products supplied to the beneficiaries. So that's why this is one of the challenges which local suppliers, but not only manufacturers, but also local suppliers face when they try to work with WHO. First of all, because they have to be compliant to those quality criteria which have been set by the agency for all the medicines and medical products supplied. Well, I was short. First of all, because I didn't want to make it too formal, but then I would have the pleasure to introduce my next speaker, which is my colleague. We work hand in hand, and his name is Alexei Yeremenko, and he is the Deputy Minister of Health of Ukraine. So he prepared a short video presentation for you, because unfortunately he is not allowed to exit the country in the current circumstances. So please, the technical unit.
Good morning, dear colleagues. I'm speaking with you from Kyiv, from Ukraine, during most critical times of our nation as we are fighting for our freedom and our goal to build a free, strong, and successful country for our children. Today, we are responding to every challenge to save lives and maintain our health system to be able to respond to the new needs caused by war, as well as to make sure that people in Ukraine continue to receive essential health services. Prior to the war, we have different tasks. Over the last 5 years, Ukraine was going through the fundamental transformation of our healthcare. We've challenged our healthcare system, introducing the program medical guarantee. It's a state guarantee package of services and change provider payment mechanism from input-based financing to the pay-for-performance mechanism. We've developed new transparent procurement mechanism and transformed healthcare facilities governance model by introduction of their autonomy. We've opened doors for private providers to receive public financing, reform national public health system. These reforms went through the major test during the COVID-19 pandemic that helped reveal our weaknesses while we built a pandemic response to our strengths. Aiming to future advance the reforms, we brought together national and international experts and developed a new health strategy, setting direction for health system transformation for the next decade. The strategy prioritizes our path towards the Ukraine on health coverage and build better system to address needs of people and communities. On February 21st, Russia invaded the territory of Ukraine. Despite the fact that Putin plans want to take over the country in a week, the Ukrainian military and citizens are fighting for their independence. Every day, healthcare workers are risking their lives, and many have lost their lives. Thousands of them were forced to migrate from homes abroad within Ukraine that, in addition to human suffering, affects stability of healthcare system. Damages of healthcare infrastructure and migration of specialists led to disruption of provision of healthcare services. People in occupied territory were left without proper access to services and life-saving medication. The devastating impact of the war of the economy of Ukraine and competing needs and priority of wartime was put financial strength on the healthcare system. Direct attack on the healthcare infrastructure among inhuman feature of the Russia aggression in war. Over the 1,000 damaged and 144 completely destroyed healthcare facilities have forced us to work quickly to restore services with the tremendous efforts of our local communities and unprecedented international support. Today, we address immediate challenge of our focus these days to equip healthcare facilities to be prepared for the winter supply with a generation and heating system to ensure their function. But we've also developed a clear plan on how we want to restore and build better our healthcare system. We've developed national recovery plan, and we fully understand the importance of health for recovery, peace, and security for our country. Health is equally important for bringing a sense of stability to people, as well as to provide fundamental stable development and strong economy. Ukraine health system needs help now to be able to stabilize, recover, and restart modernization efforts. The National Recovery Plan was developed as a result of collaboration of international partners and national stakeholders, including private sector and civil society. It clearly defines our vision on how the recovery funding will be spent. We've estimated that the health sector recovery efforts will require from 14.6 up to 20 billion euro. These resources will be spent on recovery priorities that include strengthening policies and institutions, ensure financial stability and healthcare, advancing universal health coverage and quality of services, including addressing special needs caused by war, rebuilding and modernization healthcare infrastructure, addressing healthcare workforce, strengthening public health system and preparedness, and promoting digital health and use of health data. Our recovery plan in stages. First, focusing on health system resilience and provision of healthcare services during the wartime. Second stage will focus on restoration and recovery on healthcare system, and then we will focus on modernization, strengthening human capital, advanced quality system, and improving technologies. We will continue to be very result-oriented in our recovery efforts. The targets will be built back better and show results that have impact on our community. Strategic transformation on healthcare facilities network will focus on restoring and improving primary healthcare services, build new capable hospital network with a modernized healthcare facilities, advancing technologies, and improved quality of services, establishing 10 university hospitals, and a lot more. We've also aimed to build strong national public health system with a national network of public health laboratories and advanced local production of pharmaceutical and technology transfer. We will also aim to continue build a strong fundamental and financial stability for healthcare system, gradually increasing government's expenditure on health and reducing out-of-pocket payment. I want to say that everybody can join our efforts, and today you can spend a minute to posting in social media about Ukraine, which support us. You can always follow Ukrainian news and influence. It's very important to get information from the press and media. You regularly can engage with the Ministry of Health, WHO, and other international national organizations, and we can discuss together how we can rebuild Ukraine. You can directly contact me on our email address. Also, you always can donate some resources for our restoration. This recovery and build-up of Ukraine will not be possible without a consolidated global efforts. We would not be able successful in addressing needs of people in Ukraine during the wartime without support of large and small organizations and individuals. So I urge you to support our enormous efforts, as there are many ways to assist Ukraine in our path to restoration and recovery of healthcare for our people. Thank you very much. And thank you for your support.
네, 고맙습니다. 이렇게 해서 세 번째 발표까지 마무리가 되었습니다. 이어지는 네 번째, 다섯 번째 발표는 영상 발표로 대체를 하도록 하겠습니다. 네, 네 번째 발표는 UNDP 유엔개발계획 닥터 카스텐 헨슨 서장님께서 Sustainable Healthcare Procurement이라는 주제로 발표 시작하겠습니다. 현장 참석이 어려운 관계로 영상 발표로 대체하도록 하겠습니다.
Good morning. My name is Casten Hansen. I'm the Chief of Global Procurement Services at the United Nations Development Program. It's a pleasure to be with you today and participate in this Global Healthcare Procurement Conference organized by the Korean Health Industry Development Institute. So I'll speak today about UNDP's work around procurement and the opportunities for doing business with UNDP. Just a little bit of background on what UNDP is and what we do. So we focus specifically on development issues, including the SDGs. We work with national governments, private sector, institutions, and civil society organizations. We are a global organization. We have one of the widest representation in countries around the world, at least 177, and we are established around 5 regional bureaus. UNDP coordinates all United Nations development activities at a country level through the resident coordination system as well. And we are part of the funds and programs that report to the General Assembly. So in a procurement perspective, who are we? We are one of the biggest UN procurement entities in the world. We procure for around $2 billion a year, 11% of total UN procurement. We focus on democratic governance and peace building, climate and disaster resilience, renewable energy, and health procurement. Now, what does that mean? So from a procurement perspective, our role is to support the programmatic delivery around these main pillars of work that UNDP focuses on. One of them is democratic governance, and here we support a lot on elections and biometrics. So we support, from a procurement perspective, 20 to 25 elections a year, including places like Afghanistan, Madagascar, Libya, Myanmar, etc. And what do we do in that context? We support with ballot boxes, voting papers. We provide voting booths in a box, so to speak, and we deliver that as part of UNDP programmatic activities around democratic governance. We also provide climate and disaster response. For instance, we support in the aftermath of various disasters with emergency recovery support. This could be person-packed PPE for rubble removal as part of UNDP's signature projects in an emergency situation, working in the humanitarian to development nexus. We also are strong and active in sustainable energy and storage system solutions. We do a lot of solarization of off-grid institutions and installations around the world, particularly hospitals, clinics, public health offices, general government institutions. And we provide both the solar solution, but also the electric storage system using the battery system like lithium-ion batteries, even from well-known companies like Tesla. We also have a big health procurement portfolio. So before COVID, it was at the size of around 332 million in 2018. You can see we support health infrastructure and solar energy. We support on health supplies and equipment and medicines. So non-communal diseases, HIV/AIDS, malaria, TB, those portfolios around health procurement that we are most active. Of course, with the COVID pandemic, we were also supporting up to 141 governments around the world in supplying the necessary PPE and medical equipment that was needed. We were delivering across about 50 categories of equipment, test kits, ventilators, masks, etc., gowns, gloves, that was needed as part of the government's response to the pandemic. So how do we do procurement? And there's a couple of things which are important when or if you want to engage with UNDP and participate in our procurement activities. First, it's good to understand UNDP's methods of procurement. So when we buy across many different categories, but our procurement activities are based on UNDP's standard procurement principles. And really they reflect 5 main pillars. Our procurement processes needs to be fair. They needs to be pursued with integrity, and they have full transparency. And of course, we want to achieve effective competition. And in that process, and to achieve effective competition, we apply inclusive policies towards the supply market. So we really want to encourage as many suppliers as possible to participate in our procurement activities so that we, from an organizational perspective, can achieve effective competition. And we do it in a manner that's fair, with integrity, and with transparency to encourage suppliers to engage with us. Our procurement methods are really a balance between effective competition, risk management, and the associated administrative costs of engaging with the supply market. And that you can see in the way that we distinguish between informal and formal procurement. So in UNDP, we define formal procurement at a threshold of $200,000 and up, and less than $200,000 is considered informal procurement. The methods for informal procurement that you would see is what we call micro-purchasing, or the use of requests for quotations. Everything above $200,000 is international procurement, and we use the methods of invitation to bid or an RFP, a request for proposal. So we use the ITB, as I said, when we are tendering above 200,000 for goods which are well defined, which are quantifiable, and also services which are quantifiable in technical terms. And requirements are described in clear technical terms so that they are comparable. We use a standard ITB bidding document template. We require public advertisement. We have written technical specifications, which bids either pass or fail. We require minimum 3 responsive, qualified, and eligible bids in order to process. And here, the price is the main criteria for awarding the contract. We don't give premium for bids exceeding these technical requirements. That's the nature of the ITB. For the request for proposal, however, this is a bidding method that we use when requirements cannot be expressed only by technical specifications. We're really looking for solutions. So we are soliciting the feedback and the solutions and the creativity from the market to deal and propose with our challenge. So we use, again, an RFP bidding document. We require formal advertisement, minimum 3 responsive, qualified, eligible bids. However, the difference between an RFP and the ITB is that we require 2 separate envelopes, first one with technical offer and one with the financial offer. And we open and evaluate the technical offer first. Only if the bid meets the technical requirements will we open the financial offer and evaluate. The award criteria would be based on either what we call a lowest price technical compliant offer or the highest overall technical and financial weighted scoring, which are 2 different ways of analyzing the bids. So what are the sourcing methods that you would see come from UNDP and that you can respond to as a supplier? Actually, if you go onto the United Nations Global Marketplace, you'll see that we have more than 26 UN organizations who are maintaining vendor rosters on the UNGM. We process thousands of procurement notices on the UNGM, and we have indirect access to 40 UN organizations and entities, and even non-UN organizations. We have a lot of users who register on the UNGM, several 100,000, and we actively, as UN staff, use the UNGM platform to solicit our bids. So I recommend that you log on to the United Nations Global Marketplace and register as a vendor on this space. So when you log on to the UNGM, you can see that there's an assisted vendor registration portal on the interface. It will help you search what are the eligibility modules that you can be part of, how you create and receive procurement notices, what are the long-term agreements repositories which are in place, and how you can navigate the interface using the help desk and support tools available. We also have quite a well-resourced knowledge center, so you can learn more about UN policies in general on procurement and our activities around sustainable procurement, for instance, and see how we integrate sustainability criteria in our bids. The UNGM member organizations, as you can see here, more than 26 UN and non-UN members, is actually grown and keeps growing. So this is a space which is an obvious entry point into working and supplying for the United Nations. Now, on the portal, you will see from UNDP's side at least 4 different kinds of engagements. You would see the request for information, an expression of interest, pre-qualification, or simply an open announcement. The request for information is when we engage with the market and we come out and we ask suppliers, look, we are looking for what's available in terms of technical solutions or services in this particular space. It's not a tender document, it's us doing market analysis. You'll also see expression of interest. We use that often to build up a vendor database, so we prepare for when we go for open announcement or pre-qualification. The pre-qualifications that come out are very specifically asking for companies to prepare for a certain bid that's forthcoming, but we want to pre-qualify the bidders. So it won't be going out for open announcement, but only to the bidders that are pre-qualified. So it's the first stage of a longer process. And finally, of course, we have open announcement, which is the most used tool, and which simply is a tender that goes out with an invitation for bids. We need to be aware that we have vendor eligibility criteria, and as part of these tender documents, we'll evaluate whether the suppliers have the adequate financial resources to perform the contract. We want to ensure compliance with the UN General Terms and Conditions. These are non-negotiable, so if you submit a bid, you are also accepting the general terms and conditions that we have as linked to that. We need to make sure that suppliers have the necessary organization, experience, accounting, and operational controls, plus the appropriate insurance and technical skills to deliver the product or services that we're asking for. We'll also evaluate whether suppliers have technical experience, equipment, production capacity that is necessary to be successful. We want to make sure also that suppliers are compliant with the appropriate national and international quality standards, environmental sustainability practices, which will be clearly articulated in the tender documents that come out. And vendors may not be included in the ineligibility list, which I will come to now. So vendors included in the ineligibility list will not be able to participate in our tenders. And those are vendors which have been confirmed as committing an act indicating a lack of integrity or honesty, been suspended, debarred, or otherwise identified as ineligible by participating agencies, been convicted of criminal activity by any member state, been identified on any terrorist sanctions list monitored by the UN, violated the terms of a UN contract in a serious manner in previous engagements, or refused to cooperate with any UN audit or investigation. Of course, we also undertake the right at any action that is in the sole discretion of the organization to determine a vendor to be ineligible. But these are the overall vendor ineligibility criteria that we operate with within UNDP. So what are we providing of information to suppliers? In the ITBs and the tender documents, we'll clearly provide information around the role, mandate, and authority of the procuring organization. We will give you information on how to do business, where to find the opportunities, history, etc. We provide guidelines, policies, ethics guidelines, supplier code of conduct, which are critical, the general terms and conditions, which are referred to before, which are non-negotiable, and the usual contact addresses for the bidding entity. So the composition of these bidding documents will include the model template, the RFQ, the ITB, or the RFP that I mentioned before. We'll have clear instructions to bidders, a bid data sheet, general terms and conditions of the actual contract, any special conditions of contract associated with the bid, the schedule of requirements or quantities, specifications, terms of reference, statement of works, bid proposals, submission form. So we ask you to follow the form when you supply your bid, a price schedule, which is formatted in accordance with the manner that we would like you to break down the price schedule, and possibly a performance security form and a bid security form. Our general terms and conditions, as I said, are non-negotiable. However, they are pretty standard as well. They include all the points here on the slide, giving clear directions on acceptance of purchase orders, payments, the rights of UNDP, IP issues, any measures in place for late delivery, and aspects which we want the supplier to confirm that they're not active in. We want to prohibit child labor, production of mines, etc. So all these general terms and conditions, you should read through them. They're pretty standard, but as you submit the bid, you're also accepting these terms and conditions. Finally, doing business with UNDP. Where can you find access to our tender documents? I mentioned the UNGM. That's a good place to start. But you should also know that we are very decentralized. So the real responsibility and ownership of the procurement processes are vested with the country offices. So each country office of UNDP is in fact the potential business partner. We don't have a centralized procurement entity like some other UN agencies. You can follow our work on UNDP's online procurement notices. Here's the link. We also have what we call Open UNDP, where you can explore our project activities. We also have a guideline called Doing Business with UNDP, which you can download from this link here, and really provides you the breakdown of all the things you need to know to be engaging and be successful working with UNDP. We also have general business guides, the UN Global Marketplace, the UNGM, and of course the UN Development Business with procurement notices on devbusiness.com. Here's an example of what our UNDP notices online look like on our website, and you can go in here and sign up and follow and monitor the tender documents. I would, however, recommend that you go to the United Nations Global Marketplace. All our tenders from the UNDP are also advertised on the UNGM. And this is really the single window for registration with all the UN agencies. So it's much more effective as a supplier to sign up on this platform. You can also sign up on the platform and with your vendor profile, what kind of notifications that you're looking for, what kind of categories, what are the kind of products and services that you supply. So when any tender comes up that relates and are relevant to those categories, you will automatically receive a notification by email. And this is really to ensure that all our registered vendors are aware and have equal access to our tender documents as they come out. You can also have a look at our project activities by geolocation, by kinds of work that we do. We have what we call open.undp.org, which is a platform where you can explore what are the kind of activities, and you can match that with what you're offering in terms of products and services as a supplier to see what are the market opportunities and what kind of procurement tenders that you may be able to engage in. So here's a very detailed, you can see information which we have available. It's part of our transparency efforts as UNDP that we make all this information available around our project activities, our expenditures, and our partners, so that everyone can get an understanding of our work. And as a supplier, you can determine whether there's an opportunity for you to engage with us. So here, a brief overview how to partner with UNDP. You can contact our country offices, regional bureaus, our private sector division. You can visit business.un.org or find other private sector information on our UNDP website. So on that note, we would welcome your engagement, and we look forward to the opportunity to work with you. Thank you very much for your time.
네, 영상 발표로 4번째 발표를 가름했습니다. 이제 5번째 발표까지 마무리한 이후에 점심시간 갖도록 하겠습니다. 긴 시간 함께 해주셔서 감사합니다. 다음은 AIIB 아시아인프라투자은행 PhD 태환 킴 박사님께서 Procurement Trend and Opportunities of Healthcare in AIIB라는 주제로 발표 시작하도록 하겠습니다. 역시나 현장 참석이 어려운 관계로 영상 발표로 대체하도록 하겠습니다.
안녕하십니까. 저는 아시안 인프라스트럭처 인베스트먼트 뱅크의 소셜 인프라스트럭처 디파트먼트에서 인베스트먼트 오퍼레이션 스페셜리스트로 근무하고 있는 김태환입니다. AIB는 한국에서는 아시아 인프라 투자은행이라고 번역되어 소개되고 있으며 월드뱅크, 아시아 디벨롭먼트 뱅크와 같은 국제금융기구 중 하나입니다. 오늘 발표는 Procurement Trend and Opportunities of Healthcare in AIB 라는 주제로 준비하였습니다. 사실 AIB도 설립된 지 오래되지 않았을 뿐만 아니라 헬스케어 관련 부서가 설립된 지도 1년 남짓인 관계로 파트 1에서 대략적으로 AIB를 소개하고 파트 2에서 전반적으로 Procurement Policy Trend 그리고 파트 3에서 어떤 opportunity들이 있는지 살펴보도록 하겠습니다. AIB는 기본적으로 인프라스트럭처에 투자하는 은행입니다. 인프라스트럭처는 우선 비용 효과적인 멀티섹터 플래닝을 할 수가 있고 개발도상국에서의 헬스와 교육의 갭을 메꿀 수 있습니다. 또한 창조적이고 유연한 금융기법을 활용하여 프라이빗 섹터의 투자를 모빌라이즈하고 기술과 커넥티비티를 통합하여 시대에 뒤처지는 것을 방지할 수 있습니다. 이와 같이 AIB는 인프라스트럭처를 통해 단기적인 이익뿐만 아니라 장기적인 성장과 환경 지속성을 추구하고 있다고 보고 있습니다. AIB는 특별히 포스트 코비드 시대에 전략적으로 우선순위를 두고 있는 투자 대상이 있습니다. 첫 번째는 그린 인프라스트럭처입니다. 그리고 두 번째는 소셜 인프라스트럭처입니다. 지금 제가 일하고 있는 부서가 소셜 인프라스트럭처 디파트먼트인데 저희 부서는 1년 반 전에 설립되었고 말 그대로 소셜 인프라스트럭처 투자를 전문으로 수행하도록 설립되었다고 보시면 됩니다. AIB에서 소셜 인프라스트럭처는 크게 헬스와 에듀케이션으로 구성되어 있고 상대적으로 헬스에 좀 더 비중을 두고 있습니다. 세 번째는 프라이빗 캐피탈 모빌라이제이션입니다. AIB는 오퍼레이션을 통해서 프라이빗 섹터의 다양한 리소스들이 발굴되고 활용되고 있는 것을 목표로 하고 있습니다. 특히나 코비드-19 팬데믹 대응 과정에서 각국 정부의 재정 여력이 많이 축소된 상황이기에 더욱 중요해진 이슈라 할 수 있습니다. 앞에 두 가지가 투자 대상에 대한 것이라면 세 번째부터는 투자 방식에 대한 것입니다. 실제로도 AIB는 투자를 통해 민간 자본이 실제로 모빌라이즈 되면 심사 과정에서 높은 점수를 주게 되어 있습니다. 네 번째로 커넥티비티와 리저널 코어퍼레이션입니다. AIB는 개별 국가에 한정된 개발이 아니라 국가와 지역을 연결하는 프로젝트 개발에 높은 가치를 부여하고 있습니다. 마지막으로 신기술을 활용한 인프라스트럭처입니다. AIB는 이러한 우선순위들을 실제 투자 심사 과정에 중요하게 반영하고 있습니다. 예를 들어 투자 프로포절이 이러한 우선순위 중 하나도 충족시키지 못한다면 투자 승인을 기대하기는 어렵다고 보실 수 있습니다. AIB의 은행으로서의 건전성은 주요 신용평가사들이 제시하는 신용 등급으로도 확인할 수 있습니다. S&P, 무디스, 피치 모두 AAA의 등급을 부여하고 있고 전망도 안정적입니다. 또한 주주 회원국 베이스도 100개국 이상으로 구성되어 있고 이 중 한국은 5번째 규모의 주주로서 4%에 가까운 지분을 가지고 있습니다. 참고로 미국과 일본은 현재 주주 회원국이 아닙니다. 자세한 회원국 리스트는 다음과 같습니다. 우선은 리저널 회원국과 넌 리저널 회원국으로 구성되어 있고 이사회에서 승인은 되었지만 아직 회원국으로서의 자격 조건이 충족되지 않은 국가들이 또한 있습니다. ADB처럼 아시아에 국한된 리저널 뱅크가 아닌 글로벌 MDB로 분류할 수가 있고 아직도 여전히 그 회원국 수는 늘어나고 있는 중입니다. 지금부터 좀 더 자세하게 AIIB에서 어떤 서비스를 제공하고 있는지 알아보도록 하겠습니다. AIIB는 파이낸싱 대상이 소버린, 프라이빗 섹터뿐만이 아니라 소버린 오운드 엔티티, 즉 SOE까지 넓은 범위를 포함합니다. 제공하고 있는 금융 서비스는 여러 가지로 분류할 수 있겠지만 크게 소버린 론, non sovereign backed financing, equity, guarantee 네 가지가 있습니다. AIIB의 인베스트먼트 오퍼레이션 실적을 살펴보도록 하겠습니다. 2022년 9월 기준으로 총액 기준으로는 미화 364억 불, 프로젝트 개수는 190개입니다. 보시면 금액으로는 인도, 터키, 중국, 인도네시아, 방글라데시 순서로 투자가 진행이 되었습니다. 실제 거래 측면에서 AIIB의 강점은 크게 네 가지가 있다고 말씀드릴 수 있습니다. 첫째는 롱텀 파이낸싱이 가능하다는 것이고, 둘째는 MDB 승인 등의 시그널링 효과, 셋째는 AIIB는 최신의 섹터 전략을 추종한다는 것, 마지막으로 다른 MDB에 비해서 리인한 프로세스로 효율적인 심사 절차를 운영하고 있다는 것입니다. 그 외에도 트리플 A의 경쟁력 있는 펀딩 코스트, 그리고 각종 트레저리 클라이언트 솔루션 등을 이용 가능하다는 등의 장점이 있습니다. AIIB의 소버린 백트 파이낸싱 관련해서 한국의 기업들은 다양한 프로젝트 단계에 참여하실 수가 있습니다. 우선 프로젝트는 크게 스트래티직 프로그래밍, 아이덴티피케이션, 프레퍼레이션, 보드 어프로벌, implementation, completion, and evaluation 등의 단계로 나눌 수 있습니다. 이 중 strategic programming과 identification 단계에서 코이카, EDCF 등의 bilateral, 각종 컨설턴트들, 그리고 프로젝트를 이니시에이트하고 에퀴티 투자를 제공할 수 있는 개발업자들이나 은행, 펀드 등의 금융기관 등이 참여하실 수 있습니다. 그리고 preparation 단계에서는 타당성 평가, 환경 평가, 커패시티 빌딩 등을 수행할 수 있는 컨설턴트, 건설업자 등이 참여하시게 됩니다. 그 다음 임플리멘테이션 및 컴플리션 이밸리에이션 단계에서는 각종 건설업자, 프로젝트 관리 컨설턴트, 공급업자 등이 참여하실 수 있게 됩니다. AIIB는 non-sovereign backed financing 관련해서 다양한 섹터에서 debt, equity 모두 펀딩을 제공합니다. 해당되는 섹터로는 에너지, 트랜스포트, urban, 소셜, 커뮤니케이션 등을 포함하고 특히 헬스케어는 에듀케이션과 함께 소셜에 속해 있으며 병원, 백신, 의료기기 등이 이제 해당된다고 보실 수가 있습니다. Non-sovereign backed financing의 성격상 strategic programming 이후의 프로세스에 더 집중되기 마련입니다. 특히 프로젝트 아이덴티피케이션 단계에서는 파이낸싱 소스를 확인하고 업스트림 트러스트 펀드를 활용을 잘하는 것이 관건이고, 프레퍼레이션 단계에서는 프로젝트의 뱅커빌리티를 향상시키고 효과적인 신디케이션 등을 짜는 것이 중요하다고 하겠습니다. 파트 2에서는 AIIB 프로젝트 프로큐먼트 팔러시에 대해서 간단히 알아보도록 하겠습니다. AIIB는 팔러시에 따라 AIIB 파이낸싱이 프로젝트 목적에 맞게 사용되고 경제적 효율성이 고려될 수 있도록 적절한 주의를 기울이도록 되어 있습니다. 또한 프로큐먼트에 있어 어떤 국가로부터 제한도 가해지지 않도록 해야 할 의무를 가지고 있습니다. 구체적으로 Procurement Policy와 Entry and Operational Directive라는 두 가지 문서가 퍼블릭 섹터와 프라이빗 섹터 프로젝트들을 서포트하며 각각의 경우에 별도의 섹션을 할애하여 가이드하고 있습니다. 우선 퍼블릭 엔터티에 의한 프로큐먼트에 대해서는 코어 프로큐먼트 프린시플이 제시됩니다. Economy, Efficiency, effectiveness, fairness, value for money, fit for purpose, transparency 등이 있고, procurement 스탠다드에는 strategic procurement planning, international open tendering을 선호하는 것, 그리고 transparent procurement, price와 quality 사이의 밸런스, sustainable outcome, complaint handling mechanism 등이 있습니다. 간략하게 AIB와 리시피언트의 역할과 책임에 대해 알아보는 것이 이해에 도움이 될 것이라 생각합니다. 리시피언트는 프로큐먼트의 전 과정을 포함하여 프로젝트를 실행할 책임이 있습니다. 또는 AIB는 팔러시와 계약에 따라 프로큐먼트가 수행되도록 리뷰하고 오버사이트할 의무가 있습니다. 다이어그램에서 보실 수 있듯이 따라서 서플라이어, 컨트랙터, 컨설턴트는 관련된 컴플레인 등을 AIB에 하고 AIB는 이에 따른 인베스티게이션 등을 수행하게 됩니다. AIB는 본 은행이 제공하는 파이낸싱에 대해 회원국 여부와 상관없이 모든 국가의 기업과 개인들이 물품, 공사, 용역을 제공할 수 있도록 허용하고 있습니다. 조건이 있다면 계약을 수행함에 있어 필요한 역량과 관련된 것에 제한되어 있다고 보시면 됩니다. 물론 익스클루전 조건들이 있습니다. AIB 또는 다른 AIB들에 의해 자격 상실이 되었거나 UN 생션 등을 받았거나 혹은 SOE 등의 경우가 해당됩니다. 물품과 공사의 경우에는 다음과 같은 방법들이 있습니다. 국제입찰인 International Open Competitive Tendering, National Competitive Tendering, Selective Tendering, Direct Contracting, Request for Quotations, E-Procurement, PPP 혹은 Concession 등이 있습니다. 기업들을 대상으로 하는 용역의 경우에는 다음의 방법들이 있습니다. 예를 들어 Quality Cost Based Selection, Quality Based Selection, Fixed Budget Based Selection 등이 있겠습니다. 개인들을 대상으로 하는 용역의 경우에는 다음의 방법들이 있습니다. Private Sector Procurement의 경우에는 특별한 규칙이나 절차가 적용되지 않으나 프로젝트가 Fair Market Price, Sound Commercial Practice가 Procurement에 적용되도록 해야 합니다. 이 외에도 Economy, Efficiency 등이 적용되고 계약이 스폰서가 아닌 AIB 파이낸싱을 받는 Private Entity의 Best Interest에 부합해야 합니다. AIB는 다른 MDB를 벤치마크하는데 프로큐먼트의 경우엔 주로 Sovereign Backed Financing과 관련되고 이는 두 가지로 분류할 수가 있습니다. Joint Co-Financing은 Lead Co-Financier의 Procurement Policy가 중심이 되고 각 조달 항목의 파이낸셔들이 다 같이 파이낸싱하는 형태입니다. Parallel Co-Financing의 경우에는 조달 항목별로 다른 파이낸셔가 파이낸싱을 하고 개별적인 Procurement Policy를 적용하게 됩니다. 세 번째 파트에서 AIB에서 파이낸싱을 하는 프로젝트에 어떤 프로큐먼트 기회들이 있는지 살펴보도록 하겠습니다. 프로큐먼트 기회에는 어떤 것들이 있는지 개략적으로 살펴보겠습니다. 우선 프라이빗 엔티티에서 수행하는 프로큐먼트는 개별적으로 상업적인 논리에 따르기 때문에 AIB 웹사이트에 공개되지는 않습니다. 또한 코퍼레이트 프로큐먼트, 즉 AIB 자체적으로 수행하는 프로큐먼트의 경우에는 별도의 팔러시에 의해 커버됩니다. 일반적으로 관심을 둘 만한 프로큐먼트는 퍼블릭 섹터 오퍼레이션에서 수행되는 프로큐먼트일 것이고 여기에는 물품, 공사, 컨설팅 용역 등이 있습니다. 이 외에도 프로젝트 프로퍼레이션 스페셜 펀드 혹은 멀티래터럴 코오퍼레이션 센터 포 디벨롭먼트 줄여서 BPSF 혹은 MCDF와 같이 프로젝트를 서포트하는 별도의 펀드들에서 컨설팅 용역 등으로 구성된 프로큐먼트가 발생할 수 있습니다. 작년까지 6년간 AIB 파이낸싱을 통해 어워드된 계약은 미화 130억 불, 한화 18조 원 가량 되고 이 중 90% 이상이 경쟁 입찰입니다. 종류별로 보자면 공사가 85.2%로 가장 많고 물품 12.8%, 컨설팅 용역 1.6%입니다. AIB가 시작한 2016년에 비해 최근에는 프로큐먼트 규모가 커진 것을 확인하실 수 있습니다. 2021년 기준으로는 미화 35억 불, 한화로는 4.7조 원 정도 됩니다. 이 중에서 70%는 코파이낸싱 프로젝트에서 발생한 프로큐먼트들이고 AIB는 월드뱅크, ADB, EBRD 등과 주로 코파이낸싱을 해왔고 그 외에도 ISDB, NDB, AFDB, IDB 등과도 코파이낸싱을 하고 있습니다. AIB와 같은 MDB, 즉 멀티래터럴 디벨롭먼트 뱅크의 프로큐먼트에 참여하기 위해서는 프로젝트 사이클에 대한 이해가 큰 도움이 될 것이라 생각합니다. 여기에서는 프로큐먼트 참여와 큰 관련이 있는 소브린 백드 파이낸싱 프로젝트 사이클을 살펴보겠습니다. 프로젝트는 크게 4번의 승인 절차를 거치게 됩니다. 프로젝트 스크리닝, 컨셉트 리뷰, 어프레이저 리뷰, 보드, 프레지던트 어프로벌 등이 있습니다. 그리고 그 사이에 니고시에이션 과정이 있고 최종적으로 사이닝 이펙티브니스로 마무리되게 됩니다. 프로젝트 사이클 중에는 프로젝트 서머리 인포메이션이라는 중간 단계의 문서와 파이널 프로젝트 다큐먼트라는 최종 문서가 공개되고 프로큐먼트와 직접적인 관련이 있는 공고가 세 번째 승인 절차인 어프레이저 리뷰 단계에서 일부 발생을 하고 사이닝 이펙티브 단계에서 최종적으로 발생하게 됩니다. AIB 웹사이트에 방문하시면 승인된 프로젝트와 진행 중인 프로젝트들을 확인하실 수 있습니다. 특히 소버린 백드 파이낸싱 프로젝트의 경우에는 거의 모든 정보가 올라옵니다. 일단 리스트 페이지에서 연도, 국가, 섹터, 파이낸싱 타입, 프로젝트 이름, 금액, 진행 단계들을 확인하실 수 있으니 1차적으로 프로젝트를 확인하신 후 클릭하시면 추가적인 정보들을 확인하실 수 있습니다. 공개된 정보들을 최대한 활용하여 프로큐먼트를 비즈니스 기회로 전환할 수 있는 구조화된 지식으로 전환할 수가 있습니다. 프로젝트 사이클에서 말씀드렸던 프로젝트 서머리 인포메이션과 프로젝트 다큐먼트들을 확인해 보시면 프로큐먼트 니즈가 있음을 암시하는 프로젝트들을 확인해 볼 수가 있습니다. AIB 홈페이지에는 프로젝트 프로큐먼트 어퍼튜니티라는 별도의 페이지가 있습니다. 이 페이지에서 날짜, 국가, 프로젝트, 이름, 섹터, 진행 단계 등의 정보들을 확인하실 수 있고 관련 문서도 다운로드 하실 수가 있습니다. 프로젝트 리스트 사이트에서 개별 프로젝트를 클릭하시고 살펴보시면 각 프로젝트와 관련된 문서 일체를 확인하실 수가 있고 원하시는 단계의 정보들을 확인하실 수가 있습니다. IOCT를 통한 프로큐먼트는 AIB 웹사이트나 UNDP 포털에 공개가 됩니다. 그러나 다른 MDB와 코파이낸싱 하는 경우에는 리드 코파이낸셔 웹사이트에서 확인하실 수가 있습니다. NCT를 통한 개별 언어로 작성된 프로큐먼트 공지들은 클라이언트 웹사이트나 관련 미디어에 공개가 됩니다. ADB와 조인트 코파이낸싱을 한 프로젝트의 경우 ADB 웹사이트에서 입찰 정보들을 확인하실 수가 있습니다. 월드뱅크와 조인트 코파이낸싱을 한 프로젝트의 경우 월드뱅크 웹사이트에서 입찰 정보들을 확인하실 수가 있습니다. 마지막으로 다른 MDB와는 다른 AIB의 몇 가지 특징을 말씀드리도록 하겠습니다. AIB는 무엇보다 이제 하드 인프라스트럭처 투자 중심입니다. 그래서 프로큐먼트 기회도 그와 관련해서 발생할 것으로 예상하실 수가 있고요. 그리고 AIB는 아시아뿐만이 아니라 유럽, 아프리카까지 커버하는 글로벌 MDB로서 커버하는 지역이 넓습니다. 그리고 저희는 이제 그랜트가 없고 컨세셔널 론이 원칙적으로 없습니다. 그리고 저희는 좀 더 미들인컴 컨트리 중심으로 커버를 하고 있고 프라이빗 섹터에 이제 조금 더 다른 MDB들에 비해서 비중을 높게 두고 있습니다. 또한 프로큐먼트 기회가 단순히 이제 아시아에만 커버되는 것이 아니라 회원국이 아니라도 참여할 수 있다는 그런 이제 특징이 있습니다. 끝까지 들어주셔서 감사드리고 이상으로 발표를 마치도록 하겠습니다. 아직 한참 성장하고 있는 AIB에 많은 관심 가져주시길 부탁드립니다. 감사합니다.
네, 큰 박수 부탁드리겠습니다. 이렇게 해서 오전 세션 모두 마무리하도록 하겠습니다. 시간이 조금 지체된 점 양해 부탁드립니다. 다음 행사는 점심시간 이후 1시 40분에 다시 이곳에서 오후 세션 2가 진행이 될 예정입니다. 점심시간 자유롭게 가지신 이후에 1시 40분에 다시 뵙도록 하겠습니다.